Hi, my name is Walter Milando, and this is a presentation on Crohn's disease. It's going to take over the etymology, the demographics, the anatomy, and the physiology and treatment for Crohn's disease. The summary, we're going to understand the cause and risk factors that go into Crohn's disease. We're going to explain the demographics and global statistics, and explain and identify the most anatomical and physiological changes caused by Crohn's, and explore the symptoms and treatment, as well as the modern advancements in AI in dealing with Crohn's. The etiology, which is the study of the disease. There's some genetic factors going into the disease, which are variant genes, which are in recent studies called NOD2 and ATG16L1, which is highly associated with developing Crohn's disease. There's also some nurture in the development of Crohn's disease, which is a high presence of areas of high industrialization, meaning if you're in a first world country, you have a generally higher chance of developing Crohn's disease rather than being in a country such as Uganda or the Philippines. If you're in the United States, Canada, Europe, China, you have a higher chance due to the diets there and the effect on your microbiome. There's some AI risk factors that are in development right now, but since the new development of AI, it's not gone too far, but they are analyzing the genetic factors. Some behavioral factors into Crohn's disease are smoking, fitness, and breastfeeding. Those three actions actually affect your chance of developing it. If you are to smoke, you are highly likely to get it. If you aren't as fit, you are likely to get it as well. Okay, here we go, is the demographics. The most impacted age range for Crohn's disease is 20 to 30. Generally, you don't see too many people in older age having it as well as younger age. It's generally around the 20s. Um, it is typically found in women a little bit more than men, but not to the point where it's extremely relevant. There are some racial disparities too. If you are of Afro descent, you are less likely to have the disease. Generally, it's more found in white, Asian, and Jewish populations. Here's the anatomy of the disease. As you can see here, you can see a healthy segment of the intestines. The red ones are inflamed, meaning that they are infected with the Crohn's syndrome. You can see a normal on the left side there. Um, on the right side with Crohn's, you have a higher fat wrapping, so you can see that on the right side there with the segmented part on the picture. Affected organ systems. The primary organ system, as we saw earlier, is the GI tract located at the mouth of the anus. Generally, you feel a lot of discomfort, a lot of itching, pain. Common sites are the ileum, colon, and they normally have localized symptoms, meaning you don't feel it in your whole body. You feel it generally in your GI tract. And other associated organs are the liver, skin, and eyes, and all layers of the GI wall. So here are some physiology and symptoms. Here you can see the microbiota actually infecting the intestine here, showing the physiological effect of that. Here you have several of the abbreviations. Um, what normally happens here is when you're showing the impact of physiology, normal efficient digestion means you just get the nutrients and you absorb them and you're fine after that, and you can do physical activity and do whatever you want afterwards, functioning healthily. Normally with Crohn's, you have chronic inflammation, like the red we saw earlier in that picture. It disrupts the absorption of nutrients and it causes pain. And normally a good sign, a knowing sign that you have Crohn's is diarrhea. You do feel that abdominal pain, you do feel fatigue, and you normally would see red after you would have a movement. Uh, Normally, that means that there's blood in your feces, and that's a normal good sign or a normal sign that you do have Crohn's. And causes and symptoms. Normally, the symptoms are inflammation, that I said earlier. Ulcers are a big part of it in the GI tract, and that's normally where you feel the pain. And after that, after a long while, you would see the blood forming because of the damage caused to the GI tract. And some long-term effects are malnutrition because you likely to not eat as much when you do have Crohn's disease because of discomfort from digestion. You have an increased risk of colon cancer and you have strictures. So there's a lot of long-term effects that can happen if this goes unchecked. There currently isn't a cure for the disease, but it can be mitigated. Here's the diagnosis and treatment here. Normally, a diagnosis for Crohn's disease would require a colonoscopy. So the physician would be able to see the damage to the GI tract and see the discomfort, whether if they've heard these symptoms that the patient have said to them. Um, they can use MRI imaging to view that digestive tract. It's a less invasive method, but generally, colonoscopy would be a quicker way to view that. They can also do blood tests as well to see the microbacteria that is in the GI tract to see if the person is infected. Some treatment options are anti-inflammatory medication for the GI tract because it's generally inflamed and red. Some immunosuppressants because your immune system is attacking. So if you do suppress that, it will be able to mitigate some of those symptoms. And surgery as well, which is a bowel restriction surgery. Dietary adjustments. Generally, those who are dealing lifetime with Crohn's disease do have to have dietary assessments. In there, they can't eat certain foods that are hard to digest, generally from industrial countries. And due to its chronic nature of the disease, treatments and managed symptoms are important. Managing symptoms are important to prevent flare-ups. Key takeaways. Understanding Crohn's disease. Crohn's disease is a chronic inflammatory and complex disease, and it has environmental and biological factors. The demographic generally affected by them is in industrial countries and generally not in third world countries. There's a lot of impact in anatomy and physiologically due to Crohn's disease, leading to a lot of symptoms and potential complications. And diagnosis and treatment and advances in AI are currently in progress because of the newness of AI. And there is continued research on this, and currently there is no cure. So that is my presentation. Thank you.